evening to all of you. Yes. Am I audible to all of you? Yes. A very good evening to all of you. How are you all? I hope you all are fine. Yes. Today's topic is renal function test. In the last class, we have studied about the liver function test. And in this class, we will study the renal function or kidney function test. You have already studied the anatomy and physiology of kidneys. I think you all know about the anatomy and physiology of kidney or about renal functions. Do you know? Please write in the box, do you know the functions of kidney? Means anatomy and physiology of kidney. Okay. In the physiology and in the histology, you have studies. Okay. So, we will continue. This is the structure of kidney, or we can say kidneys are the vital organ of our body. So this is nephron. The functional unit of the kidney is, please write in the box, what is the functional unit of kidney? Please write in the box, what is the functional unit of kidney? Okay. Yes. That is nephron. You all know. This unfiltered blood in and this filtered blood comes out. This is urine output. This is the cross section of kidney. This is showing a one nephron, means this glomerulus. It means proximal tube, Henle loop, distal tube, and these are collective tubes or tubules. What are the functions of kidney? You all know. First or foremost important function is maintenance of homeostasis. The kidneys are responsible for the regulation of water, electrolyte, and acid-base balance in the body. This is the most important function of kidneys. Next, excretion of metabolic waste product. The end products of protein, nucleic acid metabolism are eliminated from the body. These metabolic waste products are urea, creatinine, uric acid, sulfates, and phosphates. Next important function is retention of substances vital to body. The kidney reabsorbs and retains several substances of biochemical importance in our body, like glucose for the instant energy purpose, amino acid building material. You all know. Next important function is hormonal. The kidneys also function as endocrine organ by producing hormones. So, name any two endocrine organs. Please write in the box, name any two endocrine organs or endocrine glands which produces hormones. Am I audible to all of you? Name two endocrine glands. Yes? Please write in the box. Endocrine glands. You have studied in physiology in previous year. Yes. Name any two endocrine which produces hormone. Pituitary gland, you might be heard. Yes. Thyroid, okay. So, kidneys also function as endocrine organ and they produce hormones. Hormonal functions of kidney, like Erythropoietin. You all know about the erythropoietin, a peptide hormone, stimulate hemoglobin synthesis and the formation of erythrocyte, that is RBC. So erythropoietin 1,2,5 dihydroxy cholecalciferol. What is this? Calcitriol. Please add in the box 1,2,5 dihydroxy cholecalciferol or calcitriol, the active form of vitamin D. Am I audible to all of you? Please write in the box. So I may continue. Please write in the box. Am I audible? Okay. 1,2,5 dihydroxy cholecalciferol, that is calcitriol, is the active form of vitamin D, is finally produced in the kidney. You all know about the metabolism of vitamin D. It regulates calcium absorption from the gut. Next hormone is renin, a proteolytic enzyme. This is an enzyme, a proteolytic enzyme liberated by kidney, stimulates the formation of angiotensin 2 or angiotensin 2, which in turn lead to aldosterone production. Angiotensin 2 and aldosterone are the hormones involved in the regulation of electrolyte balance. It is important because it involves in the regulation of electrolyte balance. So these are some hormonal products like erythropoietins, 1,2,5 dihydroxycholecalciferol, that is calcitriol. Next is renin. This stimulates the formation of angiotensin 2 and in turn aldosterone production. These are involved in regulation of electrolyte balance. So there are 4 main functions. First is maintenance of homeostasis. Second is excretion of metabolic waste products. Third is retention of substances vital to body. And fourth one is hormonal function, like erythropoietin, calcitriol, and renin, or you can say angiotensin 2 and aldosterone, for the regulation of electrolytes, metabolism, or balance. Likewise, we can say these are the functions of kidney: formation of urine, the most important, formation of urine as the waste product, excretion of NPN. What is NPN? Please write in the box. What is NPN? Please write in the box. What is NPN? Yes, non-proteinous nitrogen. Okay. Regulation of salt and water balance means regulation of electrolytes and water balance, and regulation of acid-base balance. You also know regulation of acid-base balance. And last one is, we have already discussed, production of hormones. So this is another way depicting the functions of kidney. Why do we test renal functions? First, to identify renal dysfunctions or error in the function of kidneys, to diagnose early, we can say early renal diseases, to monitor disease progression or to monitor response to the treatment, and lastly, to assess change in function that may impact therapeutic efficacy, like digoxin and chemotherapy, or monitor the safe and effective use of drugs which are excreted in the urine. So for identification of renal dysfunction, diagnosis, monitoring, monitor response to the treatment, and to assess the change in the function, or monitor the safe and effective use of drugs which are excreted in the urine. So these are the important causes. Why do we test renal functions? Do you understand this? Why do we test renal functions? Dear students, these LFT and RFTs, liver function test and renal function test, are equally important for your practical examinations. So please read these slides and these material carefully. These are equally important for your practical examinations. So why do we test renal functions? To identify renal dysfunction, for the diagnosis, for the monitoring of disease progression, and for the monitoring of response to treatment. We can say this is the importance of kidney function test. Assessment of extent of renal damage, likewise LFTs. We can judge the extent of liver damage, monitoring the progression of renal damage, and monitoring and adjusting the dose of renal toxic drugs. So assessment of the extent of renal damage, monitoring the progression of renal damage, and monitoring and adjusting the dose of renal toxic drugs. This is the another way to show the importance of kidney function test. The most important function of kidneys, as you all know, this is the urine formation. The main functional unit of kidney is, you all know, nephron. Each kidney consists of millions of nephrons. Nephrons consist of Bowman's capsule with blood capillaries, proximal convoluted tubules, PCT, loop of Henle, distal convoluted tubules, DCT, and collecting tubules. Urine is formed by the following mechanism: glomerular filtration, tubular reabsorption, and lastly, tubular secretion. You all know. You have studied in your previous classes. Glomerular filtration, tubular reabsorption, and tubular secretion. You all know about Bowman capsule, glomerulus, PCT, loop of Henle, DCT, and collecting tubules. This is the structure of nephron. You all know about glomerulus, proximal convoluted tubules, PCT, Bowman capsule. This is loop of Henle or Henle loop, DCT, distal convoluted tubules, and these are collecting tubules or collecting ducts. What is glomerular filtration? You all know, you have studied. This is the passive process that results in the formation of ultrafiltrate of blood. All the unbound constituent of plasma with a molecular weight less than 70,000 are passed through the filtrate. So about 120 to 125 ml is filtered per minute by the kidney, and this is referred to as GFR. What is GFR? This is a filtrate per minute by the kidneys, about 120 to 125 ml normally. The glomerular filtrate is almost similar to the composition of plasma, or we can say the glomerular filtrate is almost similar in composition to plasma. Next is tubular reabsorption. Urine is formed by the following mechanism. There are three mechanisms. Uppermost two, glomerular filtration and tubular reabsorptions, are important. Tubular reabsorption. More than 99% of the glomerular filtrate is reabsorbed by the kidney. You all know the renal tubules, PCT, DCT, and collective tubules retain water and most of the soluble constant of the glomerular filtrate by reabsorption. First is glomerular filtration and another is tubular reabsorption. This may occur either by passive or active process. The excreted urine has an entirely different composition compared to glomerular filtrate from which it is derived. Do you understand this sentence? The excreted urine has an entirely different composition compared to glomerular filtrate from which it is derived. Now it is clear to all of you, because more than 99% of the glomerular filtrate is reabsorbed by the kidneys or by these PCT, DCT, and collecting tubules. Okay, good. Then what is renal threshold substances? These are certain substances in the blood whose excretion in urine is dependent on their concentration. Such substances are referred to as renal threshold substances. At the normal concentration in the blood, they are completely reabsorbed by the kidney. It is an important fact that they are completely reabsorbed by the kidney. The renal threshold of substance is defined as its concentration in blood or plasma beyond which it is excreted into urine. So, the renal threshold for glucose is 180 mg per dl, for ketone body 3 mg per dl, for calcium 10 mg per dl, or 10 mg per dl, and bicarbonate, for bicarbonates it is 30 milliequivalent per liter. This is the important definition, TM, that is tubular maximum. You have already studied in your previous classes, but please remember this term, tubular maximum, TM. The maximum capacity of the kidney to absorb a particular substance. So tubular maximum for glucose, TMG, is 350 milligram per minute. It is in milligram per minute. Tubular maximum, the maximum capacity of the kidney to absorb a particular substance. So it is clear now. What is tubular maximum? Am I audible to all of you? Please write in the box. Do you hear me? Yes. Okay. Now, we will go further. This is an important slide. RFT devised to give information regarding following parameters. Means RFT means renal function test or kidney function test devised to give information regarding following parameters. Means these are the parameters. Means these are the parameters for assessing the renal function test. First is renal blood flow. You all know GFR. We have already discussed renal glomerular function, renal tubular function, and lastly urinary output. So renal blood flow, GFR, renal glomerular function, renal tubular function. There are two functions, two important functions. First is glomeruli and another is tubular function. And lastly, this is urine output. So RFT device to give information regarding following parameters. What is the classification of RFTs or kidney function test? First is on the basis of urine analysis, physical, chemical or biochemical and microscopic examination. You have already studied in your practical classes. Assessment of glomerular function, which is important, very important, renal clearance test. Renal clearance test of creatinine, urea, inulin clearance. Next is blood analysis of urea and creatinine, blood or serum analysis of urea and creatinine, protein urea and hematuria. What is hematuria? Please write in the box, what is hematuria? Please write in the box, what is hematuria? Blood in urine, intact blood in urine. And what is hemoglobin urea? Yes, what is hemoglobin urea? This is hemoglobin present in the urine. Okay, good, very good. Here intact RBC, the word intact is important in the case of hematuria. Okay. Third is test to measure renal plasma flow. You all know, you have studied in your physiology classes, para-aminohippurate test, that is called as PAH. By PAH, we can measure renal plasma flow. Test for assessment of tubular functions, urine concentration test, urine dilution test, specific protein urea or tubular protein urea, amino acid urea, and phenosulforaphane test, that is PSP. Here there are four type of categories. One is urine analysis. In this we can examine physically, chemically, and microscopically. Second is assessment of glomerular function. Third is to measure renal plasma flow, and fourth is test for assessment of tubular function. So there are two functions, glomerular and tubular. These are important in this RFT. Here clearance tests are important, and here urine concentration or urine dilution tests are important. This is the important fact. Diodrest, dioiodopyridone acetic acid is used as contrast medium to take urinary tract X-rays. It is for your fill in the blanks. It is important for your fill in the blanks. Diodrest, diiodopyridone acetic acid. This is another way depicting the classification of RFT or kidney function test. First is glomerular function test. All clearance tests, inulin, creatinine, urea are included in this group. Tubular function test, urine concentration dilution or urine acidification test. Then analysis of blood serum, estimated of blood urea, serum creatinine, protein, and electrolytes are useful to assess renal functions. And another last one is urine examination, urine analysis, routine examination of urine. It includes physical, biochemical, and microscopical examinations like volume, color, pH, specific gravity, osmolarity, and presence of certain abnormal constituent like protein, blood, ketone bodies, glucose, etc. You have also performed all the tests in the practical classes. This is the important fact that about 2/3 of the renal tissue must be functionally damaged to show any abnormalities by these tests. So remember, 2/3 of the renal tissue must be functionally damaged to show any abnormality by these tests. This is a urine analysis. We will not take it in detail. This urine analysis, this is gross appearance, means physical test by volume and color, microscopically cell cast. You have already studied organized and unorganized sediments. And third is biochemical or biochemistry, like blood like glucose, creatinine and all. So we will not go in detail for this urine analysis. We will study, or we have already studied in our practical classes. This is the tabular chart reflecting this urine analysis, physical examination, volume, color, order, reaction, that is pH, specific gravity. Next is biochemical for protein, sugar, ketone bodies, bile salt. You all know. What is the diagnostic biochemical test for ketone bodies? Please write in the box. What is the biochemical diagnostic test for ketone bodies in the urine? Rothra's test. Yes, very good. And what is the test for sugar? Name anyone. For sugar? For sugar, we can perform Benedict test. Okay. And this microscopical test is cells, crystals, cast, organized and unorganized sediments. Likewise. So physical, biochemical and microscopical. Now, this is the important part of this KFT, that is glomerular function test, our first category, this glomerular function test. In this renal clearance test, first test is renal clearance test. It is generalized renal clearance test to assess or measure the rate of GF, or means rate of glomerular filtration, or GFR, and renal blood flow. So the renal clearance of a substance is defined as the volume of plasma from which the substance is completely cleared by the kidney per minute. It is per minute. Or in another way, or another words, clearance of a substance refers to the milliliter of plasma which contains the amount of that substance excreted by kidney per minute. Means in volume milliliter of plasma and excreted by kidney per minute. It is the most important lines, that is refers to the milliliter of plasma which contains the amount of dead substance excreted by kidney per minute. This is called as clearance. To assess or measure the rate of glomerular filtration and renal blood flow. Measurement of glomerular filtration rate, or GFR, that is normally in human 120 milliliter per minute. Just I told you 120 ml per minute. This is ml, unit is ml per minute. Usually equal to clearance of that substance and is calculated by the following equation, that is U into V. C means clearance of that substance is equal to U into V upon P. What is U and V and P? C clearance of the substance, that is ml per minute. U concentration of substance in urine, mg per liter. P concentration of substance in plasma, very important, P for plasma, U for urine, C for clearance, V volume in ml of the urine passed or excreted per minute. So this formula is clear to all of you. C is equal to U into V upon P, and these units should be similar, U and P. Do you understand this formula? Now it is clear. Please write in the box. Do you understand? What is C is equal to U into V upon P? Okay. Measurement of GFR, the maximum rate at which the plasma can be cleared of any substance is equal to GFR. This is, what is this? GFR, the maximum rate at which the plasma can be cleared or excreted any substance is equal to GFR. This can be calculated by measuring the clearance of plasma compound which is freely filtered by the glomerulus and is neither absorbed. It is important thing. It is neither absorbed or nor excreted in the tubules. So inulin, a plant carbohydrate, you all know. What is inulin? Please write in the box chemically, what is inulin? Please write in the box, what is inulin? This is a carbohydrate, you all know. This is the polysaccharide of fructose unit. Very good. And this 51 CR EDTA satisfied this criteria. It means inulin, inactive compound, this plant carbohydrate, polymer of fructose, is intravenously administered to measure GFR. So for renal blood plasma flow, you all know which compound is used. That is, test to measure renal plasma flow, it is para-aminohipurate test, means pH, and for GFR, we can use the inulin. Okay, clear? To determine the GFR, the substance should be freely filtered by glomerulus. I just told you, that is, which is freely filtered by glomerulus, is neither absorbed nor secreted in the tubule. Freely filtered by glomerulus, should not be reabsorbed or secreted, should not be metabolized in the kidney, should not be toxic, and should not be affected by dietary intake. These are the qualities of the substance. If inulin clearance, we can see here the formula. C inulin is equal to U inulin into V upon P inulin ml per minute. You already knew this. This is clearance, inulin clearance in ml per minute. U means inulin concentration milligram per 1 ml of urine. Likewise, here you can see the unit of U inulin and P inulins are same. Volume of urine in ml per minute, and the normal urine clearance is 125 ml per minute. If it is lower than normal GFR, so it indicates the disease condition like acute tubular necrosis, glomerular nephritis, shock, acute nephrotic syndromes, acute and chronic renal failures. So if GFR is low, then normal. It indicates following conditions like acute tubular necrosis, glomerular nephritis, shock, acute nephrotic syndromes, acute and chronic renal failures. We can classify by this table. This is minimal damage with normal GFR, grade 1, mild damage with slightly low GFR, this 2, and lastly 5 for kidney failure. GFR continuously decreases. You can see here. Now it is clear to all of you. GFR, now it is clear to all of you. What is GFR? Okay. The substance which are used for clearance test includes first endogenously creatinine and urea. You all know these are the metabolic products, creatinine and urea, and exogenously we can use inulin. So endogenously creatinine and urea, these are the metabolic products, and exogenously inulin. What is inulin? It is a carbohydrate, it is a fructose polymer, homopolysaccharides of fructose. What is creatinine clearance test? It is an important test based on the rate of excretion of metabolically produced creatinine by the kidney. Creatinine is an excretory product derived from creatine phosphate in the muscles, you all know. Creatine phosphate. The excretion of creatinine is rather constant and is not influenced by body metabolism or dietary factors. Creatinine is freely filtered by glomeruli and only marginally secreted by the tubules. It is important. One, this is only marginally secreted by tubules. So creatinine clearance, almost 145 ml per minute, is marginally higher than GFR as it is secreted by the tubules. This is the important point to understand. Creatinine is freely filtered by glomeruli and also only marginally secreted by the tubules. So it is high. It is marginally higher than GFR. Hence, it is a measurement of its measurement is a sensitive and good approach to assess the renal glomerular function. It is a sensitive and good approach to assess the renal glomerular function or kidney function test. What is creatinine clearance? Creatinine clearance may be defined as the volume of plasma that would be completely cleared of creatinine per minute. Likewise, creatinine content in the traditional way or traditional matter, creatinine content of 24 hours urine collection and the plasma concentration in this period are estimated. So this U into V upon P, this is creatinine clearance. C, likewise U urine concentration of creatinine, V urine output in ml per minute. Here 24 hours urine volume divided by 24 into 60. Then P is concentration of creatinine. Just I have told you the traditional method, and in the next slide we will discuss the modified procedure. Instead of 24 hours urine collection, the procedure is modified to collect urine for 1 hour after giving water. In the modified procedure, we have to collect urine for 1 hour. The volume of urine is recorded. Then creatinine contents in plasma and urines are estimated. The creatinine clearance can be calculated by using the same formula. That is, please write in the box. Formula is U into V upon P. What is creatinine coefficient? It is the urinary creatinine expressed in milligram per kg body weight. The value is elevated in muscular dystrophies. This is creatinine coefficient. It is important for definition. So you can see here GFR, here serum creatinine. You can see GFR is inversely proportional to this serum creatinine. Reference values, the normal range of creatinine clearance is about 120 to 140 ml per minute. These values are slightly lower in women. In human being, decrease in creatinine clearance value serve as sensitive indicator of a decreased GFR due to renal damage. This is the important line, and this is the crux of this creatinine clearance test. This is the diagnostic importance of creatinine clearance test. What is this? A decrease in creatinine clearance value serves as a sensitive indicator of decreased GFR due to renal damage. It is useful for early detection of various impairment or impairment in kidney function or various kidney diseases. So a decrease in creatinine clearance value serve as sensitive indicator of a decreased GFR. Here you can see this is GFR, this is 10 creatinine serum creatinine, and this is GFR, lowest GFR. No, so it is clear to all of you. Please add in the box. It is clear to all of you. Am I audible to all of you? Okay. And what is estimated GFR? These are the difficulty. Plasma creatinine concentration, we can estimate, we can say this is the estimated GFR because there are some difficulties. Concentration depends on balance between creatinine input and output. You all know production determined by muscle mass, which is related to age, sex, and weight. This is the important point. It is related to age, sex, weight. Concentration inversely related to GFR. You have already read it. Small changes in creatinine within and around the reference limits, it will lead to large changes in GFR. Reference limits can be misleading. Very important, strenuous exercise may increase creatinine by 14%. And the patient with liver disease and muscle wasting and drugs inhibiting tubular secretion can also raise creatinine concentration. So this is the estimated GFR. This is plasma creatinine concentration. Next is urea clearance test. Urea is an endpoint of protein metabolism. You all know. What is the end product of protein metabolism? Please add in the box. Please add in the box. What is the end product of protein metabolism? Urea, yes. After filtered by the glomeruli, it is partially reabsorbed by renal tubules. So, urea is partially reabsorbed by the renal tubules. So, urea clearance about 75 ml per minute is less than GFR, whereas creatinine is more than GFR since it is partially reabsorbed by the tubules. You have to remember the fact that creatinine clearance is more than GFR, and here urea clearance is less than GFR because urea is partially reabsorbed by the tubules. Urea clearance is less than GFR and it is influenced by protein content of the diet. Urea clearance is not as sensitive as creatinine clearance for assessing the renal function. What is urea clearance? Urea clearance is defined as the volume of plasma that would be completely cleared of urea per minute. It is calculated by formula Cm, that is maximum urea clearance, is equal to U into V upon P. Same formula here, Cm is maximum urea clearance. If the output of urine is more than 2 ml per minute, this is referred to as maximum urea clearance. You have to remember this. And the normal value is around 75 ml per minute. What is standard urea clearance? The urea clearance drastically change when the volume of urine is less than 2. Here it is more than 2 ml per minute. Here it is less than 2 ml per minute. This is known as standard urea clearance. And the normal value is around 54 ml per minute. This is the formula of a standard urea clearance. Then the standard urea clearance is calculated by this modified formula. You can see here C is U here upon V. This is standard urea clearance. What is the diagnostic importance of urea clearance test? A urea clearance value below 75% of the normal is serious, since it is indicator of renal damage. Blood urea level is found to be increased only when the clearance falls between 50% normal. Causes for increased blood urea. There are various causes: prerenal conditions, dehydration, severe vomiting, intestinal obstruction, diarrhea, diabetic coma, severe burns, fever, severe infections in various renal diseases like acute glomerular nephritis, nephrosis, malignant hypertension, chronic pyelonephritis. Post-renal causes: stones in the urinary tract and large prostate, tumors of bladder, etc. Medication, in the case of medications, AC inhibitors, acetaminophen, aminoglycosides, and various use by using diuretics. Causes for decreased blood urea. Urea concentration in serum may be low in late pregnancy, in starvation, in diet grossly deficient in proteins, because this is the end product of protein metabolism. You can correlate this. And in hepatic failure or liver failure. What is azotemia? Please write in the box, what is azotemia? What is azotemia? You might be knowing azotemia. It is increase in the blood level of NPN like creatinine, urea, uric acid is referred to as azotemia, and it is the hallmark or it is the biomarker of kidney failure. So what is azotemia? Please write in the box, what is azotemia? A-Z-O-T-E-M-I-A. Am I audible to all of you? What is azotemia? Yes, increase in the blood level of NPN. Like NPN, what are the substances which are included in NPN? That is creatinine, urea and uric acid. Next is important one. We have studied the glomerular filtration functional test. Now we will study tubular functional test like urine concentration test. This is a test to assess the renal tubular function. It is a simple test, involve the accurate measurement of specific gravity, which depends on the concentration of solutes in the urine. You all know about the specific gravity. We can measure the specific gravity by refractometer in the practical class. We will perform this experiment by refractometer or urinometer. A specific gravity of 1.020 in the early morning urine sample is considered to be as normal. It is in the case of humans. The data of animals will be included in your practical manuals or the study materials. What is osmolality and specific gravity? The osmolality of urine is variable. In human, it may range from 500 to 1200 milliosmoles. You all know about osmoles. We have studied in the practical class. The plasma osmolality is around 300 milliosmoles per kg. So the ratio of osmolality between urine and plasma is around 2 to 4. It is found that the urine with an osmolality of 800 milliosmoles per kg as a specific gravity of 1.020. It is a normal, you can see here, this is a normal specific gravity 1.020. Therefore, measurement of urine osmolality will also help to assess the tubular function. So there are two processes. First is specific gravity by specific gravity by measuring specific gravity, and another is by osmolality. Cystatin C. Cystatin C. What is cystatin C? Cystatin C is a protein marker of kidney function. This is a biomarker of kidney function. Serum reference value is 0.8 to 1.2 milligram per liter, and this is very sensitive or more sensitive than creatinine. Even minor changes in GFR in the early stage of chronic kidney disease are associated with increased cystatin C. Cystatin C is a low molecular weight, around 13.3 kilodalton protein, which functions as a protease inhibitor produced by all nucleated cells in the body. So it is formed at a constant rate and at freely filtered by the kidney. Serum level of cystatin C are inversely correlated with glomerular filtration rate, as you know, GFR. This is the important point. It is more sensitive than creatinine. This question, the more sensitive test for renal function is which one is this question has already come in your previous examination. Which test is more sensitive? So the answer is cystatin C. Cystatin C, the advantage of cystatin C over creatinine are that is not affected by age, muscle bulk, or diet, as you saw in the creatinine clearance test. It is a more reliable marker of GFR than creatinine, particularly in early renal impairment or early renal diseases or early kidney dysfunctions. Cystatin C concentration may be affected by presence of cancer. It is associated with various diseases like cancer, thyroid diseases, and smoking, and some liver diseases also. Next is analysis of blood or serum. Estimation of serum creatinine and blood urea are useful. These tests are less sensitive than the clearance test. Serum creatinine is better the indicator than urea. We will perform in the practicals the serum estimation of creatinine and blood urea nitrogen. What is the conclusion of this whole class, this RFT or renal function test? That is, the assessment of kidney function starts with the routine urine examination, like physical examination, microscopical and biochemical examination, followed by serum creatinine or blood urea.
Which contact should I call?
Blood urea estimations, and finally the specific test to measure the tubular or glomerular functions like clearance test. So first we will perform routine urine examination. Next is serum creatinine or blood urea nitrogen estimations or blood urea estimations, and lastly or finally we will go for the specific test to measure the tubular or glomerular functions like clearance test. So name any two clearance test. Name, please write down. Please write in the box two clearance test of kidney functions. Please write in the box. Name of the clearance test. We have already studied in this class. Name any two clearance test. Yes. Urea clearance, creatinine clearance, inulin clearance. Okay. So I repeat all the presentation. What are the functions of kidney? Please add in the box. We will revise all the slides quickly. Yes. Khemchand, please add in the box two important functions of kidney. We will revise the whole presentation or whole lecture very quickly. Yes. These are homeostasis, acid-base balance, electrolyte balance, hormone production. Yes. Yes, please write in the box. Jitendra Singh, do you hear me? Jitendra, what is the functional unit of kidney? Nitin, please write in the box. Then Abhilasha, what is the functional unit? What is the functional unit of, yes, Abhilasha? Okay. Next, Mansi Sharma. What is GFR? What is the unit of GFR? What is the unit of GFR? Yes. What is TM? Yes, ml per minute. What is TM? Tubular maximum, the maximum capacity of the kidney to absorb any particular substance. TM, tubular maximum. This is the important definition, tubular maximum. What are the parameters for RFT? So renal blood flows, GFR, renal glomerular function, tubular function, and urinary output. So what the most important, two most important parameters, please write in the box. Sakshi Rathod and Nisha. Ankita, do you hear me? Ankita Chaudhary. What are the most important parameters for RFT or RFT device to give information about which parameters? Okay, first is Ankita, do you hear me? Yes. First is glomerular function and another is tubular function. RFT classification. Urine analysis by the assessment of glomerular function, by renal plasma flow. Which substance is used to measure renal plasma flow? Please write in the box. Yes, Tamanna. Please write in the box, Tamanna. Which compound is used for or used to measure renal plasma flow? Yes, para-amino hipurate test, PAH. Hipurate, para-amino puric acid or hipurate. Next is, which substance is used for contrast, used as a contrast media to take urinary tract X-rays? Which substance, which compound is used as a contrast media to take urinary tract X-rays? This is diodras, diiodopyridone acetic acid. Yes. Another way of classification of kidney function test is glomerular function test, tubular function test, analysis of blood and serum, and another is urine examination by physical examination, by microscopical, and by biochemical examination. About how much renal tissue must be functionally damaged to show any abnormality by these tests? Please add in the box. How much? 2/3. Yes. Ishan, Tarun, Ishan, do you hear me? Rahul Ajwal. Okay. Rahul, write in the box the name of the tests which are included in glomerular functional test or glomerular function test. Rahul. Siddharth Paliwal, please write in the box. What are the name of the tests which are included in glomerular function test? These are renal clearance of which substances? Siddharth, do you hear me? Mohammed, Ahmed, Manisha. Manisha, do you hear me? Sachin Kumar. Name any test which is included in tubular function test. Manisha Chaudhary, Sachin, Kapil, Vikas Kumar, Mayank Jain. These are the Urine, this is a method of urine analysis. By gross appearance means physical, then microscopical and biochemical. Physical includes volume, color, order, reaction, specific gravity. Then crystals and cast microscopically, and biochemical, protein, sugar, ketone bodies, bile pigments, bile salts, and blood. Important one is renal clearance test. To assess the or measure the rate of glomerular filtration or GFR. We can say GFR for the estimation of GFR and renal blood flow. We can use the renal clearance test. This is the formula. You must remember this C is equal to U into V upon P. Yes. Inulin. What is inulin? Please add in the box. Inulin. What is inulin? And which substance is used for or for the measurement of GFR? Yes. This is the important question. Polysaccharide of fructose. This is a carbohydrate and it is used for measuring GFR. Inulin. To determine the GFR, the substance should be freely filtered by glomerulus, should not be reabsorbed or secreted. If it is reabsorbed or secreted, it gives faulty results. So it is important. If it is reabsorbed or secreted, it gives faulty result. It should not be metabolized in the kidney, should not be toxic, should not be affected by dietary intake. These are exogenous compounds, creatinine and urea, endogenous compound, creatinine and urea, and this exogenous compound is inulin, the substance which are used for clearance test. Endogenously creatinine and urea and exogenously inulin. What is creatinine clearance test? Simply based on the rate of excretion of metabolically produced creatinine by kidneys, and this is derived by creatinine phosphate, you all know. It is a sensitive and good approach to assess the glomerular function. Modified way and traditional way, you all know. In the traditional way, we take 24 hours, and in modern approach, modified approach, we will take in 1 hour. This is estimated GFR. These are the difficulties. Urea clearance test, you all know this is the urea is the end product of protein metabolism. Urea clearance test is less than GFR. It is influenced by the protein content of diet. It is not as sensitive as creatinine clearance for assessing the renal function. So most important, in this case, increased blood urea, prerenal conditions, renal diseases, postrenal condition, and some drugs. And in pregnancy, late pregnancy, starvation, diet vastly deficient in proteins, and in hepatic failure, urea is decreased. What is azotemia? Please add in the box. Azotemia, increase in the blood level of NPN. What is azotemia? NPN includes, please add in the box, which compounds, which substances? Abhiruchi Damor, Nupur Meghwal. Please add in the box. Creatinine, urea, and uric acid. Tubular function tests include urine concentration test. It includes specific gravity and osmolality. Then this is the most important test or biomarker of kidney function test. So please add in the box which is the most sensitive test for the kidney function. Answer is yes. Jitendra, Bhavesh, please add in the box most sensitive test for kidney function, that is cystatin C. This is the biomarker. Cystatin C is more sensitive than creatinine. This is the important point. Cystatin C is a protein marker, or it is a biomarker of kidney function. Even minor change in GFR in the early stage of chronic kidney disease associated with increased systemic C, and this is formed at a constant rate and freely filtered by the kidney. The advantage of cystatin C over creatinine is that is it is not affected by age, muscle bulk, or diet. In the case of creatinine, it is affected by the age, muscle bulk, or diet because it is derived from creatine phosphate. You all know it is more reliable marker of GFR than creatinine, particularly in early renal impairment or kidney diseases. And lastly, analysis of blood, estimation of serum creatinine, urea, creatinine, blood urea nitrogen are useful. These tests are less sensitive than clearance test, and serum creatinine is better indicator than the serum urea estimation. What is the conclusion of whole class? The first we can perform, or we will perform the routine urine examination like physical, biochemical or microscopically, and then followed by estimation of serum creatinine or blood urea nitrogen. And finally, we will go for specific tests to measure the tubular or glomerular functions like clearance test. So it is clear to all of you. Please write in the box. It is clear to all of you. It is equally important for your practical examination. LFT and KFT or RFTs, these topics are equally important for your practical examinations. Now it is clear to all of you. Please write in the box Nupur, Khemchand, Nitesh Chaudhary. Is it clear to all of you? This topic RFT. We have not taken the physical examination or biochemical examination or microscopical examination in detail because it it will include it in I think in practicals. So thank you very much. Hope you all are fine. Stay home. Thank you very much. Thanks again. Thank you very much.